Hi everyone, and welcome to today's video. I'm Mary Felling, physical therapist. And today I'm going to be showing you a couple of exercises that are very effective in reducing sciatica, improving mobility around the hip and buttock that is causing some of the problems of sciatica. So first of all, sciatica is just referring to the sciatic nerve and irritation of the sciatic nerve. And when there's any irritation on a nerve, it inflames and becomes painful. And because this sciatic nerve runs off our spinal cord, down the back of our hip, buttock, down the back of our leg, when it's inflamed, it can inflame anywhere along that line or the entire line of the sciatic nerve. And you have one on both sides, so this could be a left or right side situation. There's a lot of reasons, but the top most common reasons people have a sciatica problem is because they have a very tight piriformis. They may have a bulging disc or stenosis in the spine, or there's just been an accumulation of tension and tightness in the buttock, in the hip, and in the low back area over the years that have accumulated to a point where it's now compressing and irritating the sciatic nerve. So our treatment today is going to be some strengthening for the core muscles to help support the low back and relieve tension off the sciatic nerve, and to give some stretching and releasing in the buttock and in the piriformis to help return the mobility to the hip, the low back, and again, take tension off of the sciatic nerve. So let's get started. All right, all you're going to need today is a pillow and a place to lie down. So we're going to start out with some lower abdominal strengthening. So we're doing some core strengthening to help out that poor little sciatic nerve. This is safe to do and fine to do if you already have sciatica problems and if you have low back pain. All right, so in this position, hands are across the chest, and you're just going to lower back and come up. It's called a reverse curl up. If this is too much, if you really have weak core muscles, you can start with your arms in front of you, and that'll be less work for your lower abdominals. All right, we're going to do 3 sets of 10. You ready to go? Here we go. Hold that low belly tight. So it's this very, very short move. Tighten as you come up and keep it tight as you're lowering back. Very good. Here's number 5. Your feet are about hip width apart. Tighten, feel really tight, just above that pubic bone. How about 2 more? And last one for our first set of 10. Take a short break, 2 deep breaths. Great, let's go for our second set of 10. Here we go. Here's 2, let's do 8 more. Tighten, really pull, tighten and pull yourself up from here. Not because your shoulders are coming up or you're pulling in from the hips, but you're pulling down from that lower abdominal. It's tight and tense to pull your upper body forward towards your knees. We've got 2 more to go here, everyone. And here's number 10. All right, short break, 2 deep breaths. Oxygenate that blood. All right, third set, here we go. You know what you're doing. And again, if this is too much and you're feeling too much strain into your abs, put your arms in front. It'll help make it a little bit easier for you. All right, for the rest of you, keep your arms here. And we've got 2 more to do after this one. And last one. Very good. All right. So our 3 sets of 10. Now you're going to lie down. You can use a pillow if you want. You don't have to. I prefer it. I like to have my head and my neck supported. We're going to do a pelvic tilt with a bridge. It looks like this. Tilting the pelvis under, tucking the rear end under, flattening the low back, holding that pelvic tilt, lift up in a bridge, tighten a little at the top, come down, hit the rear end, and then uncurl from the pelvic tilt. All right, here we go. 3 sets of 10. Pelvic tilt, lift, come on down, and then uncurl from the pelvic tilt. I'm doing 3 sets of 10. Squeeze right at the top a little bit with your glutes. Here's number 3. And your goal when you're doing this is as you come up, you got a straight line from your knees, hips, and down to your shoulders. All right, here's number 5. Squeeze the glutes at the top, pelvic tilt, come up. You might even feel a stretch along the front of your hips. That is what's happening. You're getting a stretch there, but you're tightening that glute. So important in helping to relieve pressure on that sciatic nerve and giving the core stability back into your system. Here's number 9. And one more. Pelvic tilt up, squeeze at the top, come down. Last thing that happens, you come out of your tilt. Short break, 2 breaths. Here we go, pelvic tilt. Bring it up. Feet are about hip width apart. You know, they're not really far apart. They're not, definitely don't have your feet together. Make sure you've got a good space between them. It gives you more balance so that your low back's not doing a lot of work here. Here's number 4, squeeze at the top, come down, let go of that tilt. Squeeze at the top. Squeeze. If the squeeze is too much to do, just keep it out of the process right now. That was number 7. Here comes number 8. Squeeze. You'll still get a lot out of this. And here comes the last one, number 10. And very good. 2 deep breaths. All right, 3rd set. Here we go. Coming up. If you're already fatigued, if you feel like your glutes and your abs just can't do anymore, that's fine. Take a break. That's where you're starting. Everybody's body is different. Just honor where you're at. Don't do more than you can. Just start with 2 sets of 10, and then in a couple of days, add another 2 or 3 reps on until maybe 5 or 6 days from now, you can do 3 sets of 10. All right, here's number 6 in our 3rd set. Pelvic tilt, tighten, squeeze at the top. You might be feeling your hamstrings work a little bit now. If you're so tight and your hamstrings are spasming, make sure you do a hamstring stretch before you do this exercise. Last one. Nice and tight, high, come on down. Very good. All right, this next one is a myofascial release. You're going to be on your back, and your legs are going to come up towards your chest, and you want to take the leg that has the sciatic symptoms. So let's say your sciatica is on your right side. You're going to cross your right leg over your left. So the back of my right thigh is on the top of, back of my right leg is on the top of my left thigh. If your sciatica is down on the left side or just in the left hip, the left leg goes on top of the right. And you come in, and you're just going to hold in like this. If you have knee problems, hold under the knee. All right, so we're going to set a timer for 5 minutes. Bring those legs up, get them crossed over. If this is painful in your groin, put a rolled washcloth down deep in your groin. You can hold underneath or on top, whatever you'd like. Here we go. We've got that timer going. So in a myofascial release, myo means muscle, and the fascia is the cobweb. It's like connective. It is connective tissue in our body, and it's connective tissue infuses all of our muscles and tendons, all of our joints, the discs in our back, our bones, ligaments, nerves, blood vessels. Well, the fascia in our nerves and in our muscles can become tightened down, dehydrated, and kind of glued down. And when it does, it creates pressure in that tissue that it lies within. So if it's inside a muscle, it's creating a lot of compression on muscle. And muscles are pain sensitive, so we become painful in those muscles, and they're tight and shortened. If it's the fascia going through the nerve, and in the case the sciatic nerve, that fascia is tightening on nerve tissue. Well, nerve tissue is very pain sensitive. All of our tissues are pain sensitive, but particularly the nerves. So when you're doing this, you're going to get a little stretch on the sciatic nerve. So if it's too much for you, you can start back here. You can just hold here. You could even just put, if this is too much, put 2 pillows underneath your feet and just hold the position like that so that your back and your hips aren't working. But for the rest of you, if you can bring it closer to your chest, it puts a nicer elongation through the sciatic nerve and therefore also the fascia. And actually what we're getting right now on the top leg side, back in that hip, is you're getting a lot of stretch through the glutes, through the piriformis, the fascia through the whole buttock area, the fascia through the hip and the low back. This is a beautiful elongation and stretch for that entire area, which can contribute, all of the tissue back there can contribute to compression on the sciatic nerve, restriction of motion on the sciatic nerve. So this is a beautiful broad-based kind of technique to do. And I do want to remind you every day that you want to do this for 14 days so you can get a jump and some momentum going on relief of that sciatic pain. And then after 14 days, just maybe do this once every, this whole circuit of these 3 exercises we're doing just maybe twice or 3 times a week to maintain that positive improvement, those positive changes. So if you haven't already, I invite you to subscribe to my YouTube channel. There are so many wonderful techniques and routines I have here to help all kinds of problems, from headaches and jaw pain down to your feet problems, and certainly here in the hips and sciatica problems are being addressed. But subscribe so that every time a new video comes up, you'll be notified right away and you can continue taking care of yourself and living that pain-free lifestyle you deserve. And I do appreciate the comments. If there's something that you want to dive deeper into, let me know. If there is a question you have about a particular exercise, let me know and I'll get that answered to you. If there's something you'd like to see done, if there's a video you'd like to see, let me know. Because this channel is for you. It's to help you feel better, to help you live that precious life in the best way possible, pain-free, happy, and mobile. All right, we're in this last minute. You're welcome to stay here 7 minutes, 8 minutes. You'll just get more and more release. You might even feel softening through your low back. You might feel softening down the back of your leg, your thigh. It's wonderful. But I'm stopping at 5 minutes. That's where the beginning of fascia starts to elongate, is once there's been 5 minutes of a stretch put into the system. Now we're getting the fascia. Traditional stretching gets the muscle, 5 minutes plus. Now you've got the fascia. Now you've got that thing that very rarely gets addressed, but yet is the underlying cause of chronic pain not leaving, or chronic sciatica sticking around. So we're getting into that. All right, we've just got a few seconds left. As I said, go ahead and stay here for longer if you'd like. For the purpose of this video, we're going to end it at 5 minutes. Thank you so much for joining. I hope you find a lot of relief with this technique. Leave me a comment, and I will see you in our next video.